And more about advances in robotic surgery in many areas of medicine.
That's right. Doctors at Yale Cancer Center have just marked a major milestone in the number of robotic surgeries to treat diseases of organs, including the pancreas, gallbladder, and liver.
Joining us now is Dr. Kevin Billingsley, surgeon and chief medical officer at Yale Cancer Center and Smilow Cancer Hospital. Doctor, good morning and thank you for your time.
Hi.
Good morning, and thank you for having me here with you this morning.
Of course, very important to talk about this and, of course, celebrate these milestones. First, let's learn about your milestone and the types of conditions your team treated.
Yeah, I'm happy to share with you. I'm a surgical oncologist, and my specialty is treating cancers of the liver and pancreas. And what is really exciting is these are diseases that we have traditionally treated with major open operations requiring patients to be in the hospital for extended periods of time. And with robotic technology, we are really moving forward in doing these operations now with a minimally invasive approach, small incisions, shorter hospital stays.
Absolutely, doctor. And you kind of mentioned it there, but for people that don't know much about robotic surgeries, can you tell us the difference between a robotic surgery and a traditional surgery?
Absolutely. So a traditional operation involves a fairly large incision, which requires healing time, pain, discomfort, time away from work. Robotic surgery involves several small keyhole incisions that heal quickly, and the instruments that are actually inside the patient are controlled by the surgeon at a console, but using robotic technology and a lot of very high technology visualization and magnification so that we as surgeons can see the operative field very precisely, do delicate operations with much less trauma to the body.
Very interesting, and I'm happy you pointed that out because I don't think everyone realizes when we talk about robotic surgery that it's still the surgeon leading the way. So thank you for that information. Also want to point out here that you were the first in our state surgically to place a special pump in a patient. Tell us about this pump, what it does, and what this means.
Yeah, this is super exciting for us. This is what's called a hepatic arterial infusion pump, and this is a pump that is this size. This is a little mock-up. It sits under the skin and it is connected to a piece of tubing that we implant surgically using the robotic approach into the artery that goes directly into the liver. And for a group of our patients who have cancer in the liver, it allows us to treat them with very high doses of chemotherapy to the liver and that tumor area itself without the chemotherapy circulating around the body. So in other words, the treatment goes to where it needs to go, but no place else. And it allows really effective treatment with a diminished toxicity. And really, this is the first time we've been able to do this with the robotic approach and has spared patients these larger incisions.
Wow.
That is truly an amazing breakthrough, doctor. And so this is going to help people that are going through cancer, help them with, pain relief, and would you say faster recovery as well from chemo?
100%. The procedure's done, the patient's out of the hospital within a day, and then they can go on to their treatment and kind of get back to their life without an extended hospital stay or disruption.
Quality of life, that is very important, doctor. Thank you so much for your time. And of course, thank you for the work that you do. Very impressive.
Thank you, doctor.
Very happy to be here. Thank you.
All right.